The hamstrings are a group of 3 muscles that run down the back of your thigh. So they cross the back of the hip joint and the back of the knee joint. An injury to these structures would be categorized into grades. So a grade 1 would be a mild muscle pull or strain, you might hear. A grade 2 would be partial muscle tear, and a grade 3 would be a complete muscle tear or rupture. So what would the mechanism of injury be? Hamstring injury usually happens during a sudden, powerful movement, such as sprinting, lunging, or jumping, which causes the muscles to overstretch or contract in a stretched position. And so how long does it take for this kind of injury to heal? The overall recovery time would vary depending on the severity of the injury and how it's managed in those early stages. A minor injury might just take a few days to settle down, whereas a higher level injury might take weeks or months to recover. The Achilles tendon is a structure at the back of the ankle that joins the calf muscle to the heel bone. It's a thick band-type tissue. An injury to the Achilles tendon can be acute, or it can be a chronic injury as well. Acute injuries to the Achilles tendon are graded. So grade 1 is a mild pull or a strain. Grade 2, a partial tear. Grade 3 is a complete tear, or you may hear it referred to as a rupture. It is also common to get overuse type injuries, which would be included under the term of tendinopathy. In the population of high-level athletes who are training their bodies to avoid overuse injuries, an Achilles injury is much more likely to be of the acute nature. So what would be the mechanism of injury? A sudden forceful contraction of the calf muscle that becomes too great for the strength of the tendon. So this might happen during hopping, jumping, or landing. Athletes should expect to be out of competition for 6 to 12 months. That's an average of 9 months. So what is a metatarsal fracture? A metatarsal fracture is a break to one of the long bones in the foot. So these bones here in the foot are the metatarsals. Fractures can be categorized into the following categories. There are stress fractures, which are tiny cracks caused by overuse. There are undisplaced fractures, which are sometimes referred to as hairline fractures, and that's a break in the bone without much damage to the surrounding tissues. There are displaced fractures, which is where parts of the bone are misaligned. Comminuted fractures, where the bone has broken into several pieces. And finally, open or compound fractures, where the bone has broken through the skin. The metatarsal bones are numbered from 1 through to 5. So number 1 is in line with the big toe, through to 2, 3, 4, and 5. Of metatarsal fractures, it's most common to break the 5th metatarsal on the outside and least common to break the 1st metatarsal on the inside. So hopefully that's shed some light on some of these injuries that you may hear about in the press. Thanks for watching.